Hi Tanya, welcome. So this is the first of our meetings from your fourth year clinical attachment that you're doing, and what we're planning to do today is a case-based discussion. Now the aim of this is not for you to just present the clerking as you would do traditionally in ward rounds, but to explain the case to me. Because what I'd like to do is tell me about this case that you've prepared.
Alright, it's a bit odd for me, but I'll give it a go. So I saw a 45-year-old lady who her main complaint is anemia, iron deficiency anemia as I understand it. And she had presented with tiredness, lethargy and generally feeling quite low. The history of this is that she attended her GP surgery about 3 weeks ago, did some blood tests and that came back with iron deficiency anemia. But the symptoms themselves started about 4 to 6 months ago. It's worth noting that around the time her sister had just died, quite suddenly, of breast cancer complicated by septicemia, which was the cause of death. Important points to note is that her hemoglobin is 8. She does complain of dyspnea. I think in terms of things that could be causing it is that her husband is a vegetarian. She's not really eating much meat at the moment. She snacks quite a lot. They're having lots of pizza and easy foods, not very nutritious. Alcohol intake isn't excessive. She was diagnosed with IBS 17 years ago, and her stools are loose and watery at the moment, slightly more common, more increased frequency. But she doesn't have any weight loss, and I was a bit concerned about things like colon cancer, but she didn't seem to have any other signs of that. Past medical history, like I said, she's got IBS for about 17 years, and she's hypothyroid, which began 3 to 4 years ago, and she's medicated with thyroxine for that. She doesn't have any surgical history other than an appendectomy which she had when she was a teenager, and the only tablets that she's on are thyroxine. She's not allergic to anything, and she doesn't take anything over the counter, recreational or herbal. There's no family history at all of anything like this in the family or anything else other than her sister who died at the age of 49. She doesn't smoke, exercise is quite good though. Recently she's had to decrease this because of the breathlessness, which is particularly on exertion. And there just isn't anything significant to me in the history other than that she was anemic during both of her pregnancies. I did a quick systems inquiry and there was again nothing of note. I thought I'd better check all her systems, and there was nothing. She had a UTI a few years ago, she's got IBS, other than that she's perfectly fine.
Right, so from having gone through all of that, what do you think is the underlying cause of an iron deficiency? Did you get enough from the story to tell you that?
No, I mean I made some notes to myself afterwards about what might be going on. And I think my main concern would be nutrition, just the lack of food that had anything in it, any kind of iron in it. She's not eating any meat, and she doesn't even sound like she's eating vegetables, despite the fact her husband's a vegetarian. Afterwards I had thought the most common cause of anemia in premenopausal woman is medicine, and I should probably have probed that some more. But I didn't.
Did you ask her about that at the time?
I didn't, not at all, and she had told me that she was anemic during both pregnancies, so it's something I should have asked.
I think that's right.
So in terms of trying to find out more, I'd probably like to do some more blood tests, maybe look at ferritin binding, perhaps check that it's not anything else, check her thyroid status. Right,
what would ferritin binding tell you? Why did you think about ferritin binding as the next strategy?
I was wondering, my knowledge is quite blurry, it's from deep and dark, but I know that ferritin binding ratio will tell you whether it's I think it can tell you if it's a dietary thing or a loss thing. If there was, I'm making it up, aren't I?
Right, well it sounds like we're generating a bit of a learning objective for going away after this, so getting at the causes of iron deficiency and differentiation between it, how do you tell if it's dietary versus loss? What does the patient think's going on?
I didn't ask her, to be honest. Perhaps something I should have.
Did she express any concerns about?
No, I think she was quite concerned about the fact her sister had died of breast cancer. So I did ask her a few sorts of questions about cancer in general without being too obvious, you know, about weight loss and clothes being looser. I'd asked her about changing stools and colour, any pain or lumps and anything like that, but she didn't have anything. Apparently, I think it'd probably be worth doing a fecal occult blood just to check, but I think that was her main concern, was that it was something cancer related. She probably also wondered if it was a mood dependent type thing, the fact that her sister had died and she was just struggling with that, but then she realised it was organic because the blood tests had come back as normal.
Does it strike you as likely that this might be something cancer related?
It's always likely. She's 49. I mean, she's still a bit on the young end of colon cancer, but it's a fairly frequent condition, I think.
Right. Now, you mentioned that she'd been given a diagnosis of irritable bowel syndrome, and you thought that this didn't sound like colonic cancer. So what made you say that? What features of her history were compatible with irritable bowel versus colonic carcinoma, which you feel it isn't?
Okay. She's also bloated. It's every few weeks. It's been going on for 17 years. Hopefully it will be cancerous. She has loose watery stools. I thought if it was cancer it might be, you know, melena type, dark. I know a change in bowel habit would be a sign perhaps of colon cancer, but this is something quite long standing, whereas that would be more acute.
Right, so you talked about doing fecal occult bloods. How else would you make a diagnosis of colonic carcinoma?
Well, the golden standard would be a colonoscopy, but it's quite an invasive procedure, so I don't think it's one I do lightly, particularly because the cancer's a breast cancer. If her sister died of colonic cancer, then I'd say probably go for it, but it's a breast cancer. But then I think anyone with iron deficiency anemia should be investigated for colon cancer, shouldn't they?
Right, so you want to put together an investigation plan for this lady. Your mission here is to tell why she's got iron deficiency anemia. So how would you propose doing that?
I'd start bedside with basic tests. I'd do her basic obs, you know, the temperature, pulse, urine dipstick, perhaps check on if there was any hematuria, that could be another cause. I would then go more invasive, do some blood tests, look at these ferritin binding proteins and check her thyroid status, look for other causes. She says she doesn't drink very much. I mean, I know that would give a different picture, that would be more macrocytic anemia, but just a general blood screen, common things that might cause this. I would actually write this down. I'd like to ask her more about her menses. She is only 45, and I think that menopause generally tends to start at age 55, so anything from 49 to 55. So I'd like to ask her about that some more. The diet I probed quite a lot, but perhaps we could refer her to a dietitian and see if there's any way it can be improved and check on that. Like I said, the fecal occult blood, it's a nice and easy, non-invasive tool.
Right, good. Well, you've formulated what sounds like a very logical management plan there.